going to be talking with the director of strategy from Mayo Clinic, and just someone who is a firm part of the digital health ecosystem at Mayo. And for those of you who don't know some of the really innovative things that the Mayo Clinic is doing, please take a look there. John Halamka and his entire team have really led some extraordinarily nice programming. We've had a couple of startups that we've done studies on that have actually either come from the Mayo program or gone to the Mayo program and had really, really strong experiences. So we can't recommend it highly enough for folks that are looking to help grow their companies and want to work with a solid health system with the highest degree of ethics and a really nice model that's extremely fair in terms of how they contribute to the company, and then also how they collaborate with companies. But anyway, let's dig into Walé's background. Walé, if you could just give us a minute or so thumbnail sketch of your background for everybody.
No, really appreciate the opportunity, Stan. So, name is Walé Elegbede. I serve as the Director of Strategy Management Services at Mayo Clinic, and really I oversee everything from our diagnostics test development efforts to disruptive technologies. But also when it comes to health equity, that's something that is a passion of mine. So really appreciate just the opportunity to be here, which at HITLAB. You guys are doing just amazing work, and this is a very timely topic. So I will, if it's okay, I'll just get started. And when it comes to just healthcare and the digital divide, this is something that is not something that should be taken lightly. And again, in terms of just my background, I work at Mayo Clinic. I again overseeing those innovation areas, but in addition to that, I serve as the president of the Rochester branch of the NAACP. I've been fortunate to give a TED Talk. I give keynotes, leadership, things of that nature. But this topic is important to me because my personal ethos is I believe in the power of human connection and ideas, and that connections and bridges must be built to really improve our world. And so this is something that is not just something I do professionally, it's also something that I do personally. And so this is why, all the work that we all do is so critical here. I'll just play this short clip here. So the work we do in Mayo Clinic is so important, and it starts with our primary value, which is the needs of our patients come first. And since the founding of our organization, that's been the focus. Where our founders have basically enforced that in us. So everything we do is really centered around that, from digital pathology to health equities. It's really how do we focus on that patient. And when you look at our vision, it's really about transforming medicine to connect and cure as a global authority in the cure of complex and serious diseases. And our mission is really just inspiring hope, healing, and promoting health through an integrated clinical practice, education, and research. Another thing that's also important is, we are woven together by our rich ties. And when I talk about our rich ties, we're talking about respect, integrity. We're talking about compassion, healing, teamwork, innovation, excellence, and stewardship. And I mention all of this because these are really our North Star. Dr. William Mayo, one of our founders, he said that at the close of a man's life, to estimate his worth, it is wise to see him in relation to his life surrounding, to know not only the part that he played as an individual, but as a component part of the great events to which he contributed to the betterment of mankind. And so, again, the work we do is so, so important. And when it comes to the work that you all are doing at HITLAB, and this symposium, Heartbeats of Equality, the stakes could not really be higher. Now, when we look at health equity, for example, and I believe you've touched on some of these, COVID-19 really shined a light to the structural and systemic issues that have plagued many communities. And while this was new for some, it wasn't new to people in the Black or underrepresented communities because they were living this, or they had family members that this was really their reality. And when we take a look at just some reports by the National Center for Health Statistics in 2020, for example, they show that there was a life expectancy decline, not seen since the 1940s. And this was occurred across the board, but it was greater for communities of color. Now, when we also take a look at health centers, which are, they provide affordable primary healthcare services to individuals and families, whether it's people that are experiencing homelessness or people that are agricultural workers or public housing people, and sometimes some of our veterans, we see that 63% of those patients that use those services have diverse backgrounds. Also, the same report showed that patients that use those services, they experience chronic conditions at higher rates than the general population. So we can basically see that there is a tie-in to race. And so when we think about disparities, it's really, really impactful. The other thing is that education is also linked to health equity. And oftentimes, it's something that is neglected, that we don't think of it from a social determinants of health, but it's so crucial. And in Minnesota, for example, the state's own data show that if you're an African American, a Black person, or a Native American, 60% of those students won't go to college or won't complete a college degree. And it's not because you're not talented, it's really those structural issues. And Lancet Public Health also noted that education was strongly linked to life expectancy, to health behaviors, educational attainment. You're able to get a better job, better outcomes, and better income. And another health equity challenge really has to do with disparities in treatment. And a 2003 study from the National Academy of Sciences concluded that racial and ethnic minorities, they tend to receive lower quality of healthcare than non-minorities. And even when, things like access-related factors like insurance, we're all the same. So again, it just shows you the challenges that we sort of have. And, outside of healthcare, just everyday discrimination affects health. And there was a study from a Black woman that just showed that many women basically had a high burden of stress when it came to their concerns for their kids. And so the causes of health disparities are varied, they're multi-dimensional. I'm not going to read through all of this list, but it goes from everything from patients having mistrust of providers and providers stereotyping patients and everything in between. But innovation is something that has such a huge potential. And when we look at things like AI, and the promise of these technologies, we have a great opportunity to do even great things. But there has to be a focus on ethics. There has to be a focus on bias, and making sure we have the proper governance in place. And numerous research have also shown that, just the benefit of health technologies, the benefit of innovation. And if we take a look at COVID-19 during the pandemic, for example, telehealth was very, very invaluable. So with technology, there's so much we can do, but there's still a digital divide. And when I talk about tequity, I'm not talking about, it's not a play on words. and we're not trying to be cute, but these are inequities that occur as a result of a digital divide, as a result of, people that have financial, social, and economic disparities by race, but also along social economic lines. For example, if you have a lack of access to technology, a lack of access to broadband, or maybe people are primarily using smartphones instead of computers and desktop because they can't afford that. I believe you talked on even ageism. There's a digital divide when it comes to ageism, right? And a study showed that older adults experience higher rates of digital exclusion. So it becomes really important for us to make sure that we're factoring all of these things in. And when you look at just, how bad the problem is, in terms of people that have technology access on the right side of the screen to those that, don't have the right technologies and also experience in health inequities, you just see how bad the challenge is. And Pew Research, they also did a study where they found that people that had less than $30,000 a year do not own a smartphone, and 4 in 10 adults with lower incomes don't have an internet access. So when we're thinking about just the challenges and how do we make sure that we get value-based care to all, those are factors, those are things that we need to really think about as we develop solutions, so that way we don't worsen disparities. And the digital divide was really concerning to the UN general, that basically he mentioned that it's basically now a matter of life and death. And it's threatening to become the new age, the new face of inequality. So how do we move forward? And I, for one, believe that trust in our people, trust in processes and systems are so crucial to really addressing the digital divide. And when I talk about trust, what do I mean? Trust generally can be understood as the psychological state where positive expectations of others is anticipated, where there's a emphasis on behavior, where there's a emphasis on positive outcome and participation. And when you think about social trust, it's really about that people in society can generally be trusted, and that there is participation, and there's also inclusion of minorities. And so those are some things that are so important. And building trust requires you to be curious. It requires you to lean in. It requires you to be an ally and to be an advocate. And it also requires you to be really intentional. And in terms of how we can be intentional, we all know that social determinants of health, they contribute to about 90% of outcomes. And in 2018, for example, it cost the United States, I believe, $451 billion. But healthcare systems, we play such a vital role in addressing those gaps and bridging the gap with marginalized communities. And by activating communities and reimagining new solutions, which can leverage technologies like AI in the prescription of community resources, we can actually have more impact. The other thing is that if we take a look at a culture based trust model that I created when I was doing my doctoral classes, one thing that was crucial was trust as the foundation, followed by open communication, followed by compassion, having a vision and empathy before whatever benefits and rewards can be achieved. An example of this is when you look at, in Mayo Clinic, there's an initiative that Mayo Clinic and the Rochester branch of the NAACP did. It's called the Rise for Youth program. And this was focused on educational disparities, those that 60% of students don't want to complete college, so this was an initiative where Mayo Clinic and NAACP are working hand by hand and able to address those disparities. And so we're activating the communities, the NAACP being the cultural broker is activating those communities and being really involved in it. So I say this because when it comes to creating trust, you all, and we all play such a critical role in our respective organization, but there has to be open communication. There has to be that excellence in care. There has to be that compassion. There has to be listening. There has to be that equality, before we can actually get that value-based care for all. And I understand that the work is hard, and sometimes it's, taking the first step can be daunting, but it is going to require bold leadership, ethical leadership, and innovation. And so, you know, as I leave you here, I'd just like to leave you with some guiding words from Dr. King. And Dr. King said, you know, take the first step in faith. You don't have to see the whole staircase, just take the first step. And so, you know, as we are listening today to all of these wonderful speakers, and as you head back to your respective organization, yes, you may not see the entire staircase, but as John Lewis said, keep your eyes on the prize. And so let us take that first step and invite others in that journey as well. And by doing that, I believe that we can actually get closer to creating those pathways to value-based care for all. It's what I do. It's what, you know, my colleagues at Mayo Clinic do. This is what the mission is, to really take care of our patients, you know, within our walls and outside of our walls. And, you know, I encourage you all to do the same. Thank you.
This is just fantastic. No, thank you, Walé. This is a tremendous presentation and really thoughtful and very thorough. So thank you for joining us today. I'm looking forward to having you back again in the future.
Absolutely. Thank you very much. Stay blessed, everyone.